We're joined now by Dr. Anthony Fauci. He's President Biden's chief medical advisor and the country's top expert on infectious diseases. Dr. Fauci, good morning. We heard what the president said there. Everybody eligible by the middle of the month, but supply is still still short of demand. A lot of people having trouble making appointments. Why is that?
Well, you know, it's getting better and better by the day. I mean, if you just look around the country, we're seeing that there was a gap between supply and demand. And literally every day that goes by, if that gap is closing. And that's the reason why the president was able to make that statement, pushing up the date when people would be, essentially everyone would be eligible to receive the vaccine. So although there was some issues regarding early on, that the demand clearly outstripped the supply, that's closing down. That gap is closing, and that's really good news. You know, we're now going between 3 and 4 million doses per day. And every day that goes by, it gets us further and further towards that goal of being able to get ahead of any possible surge. So all that you've just said right now is actually all good news.
How do you feel about the progress we're making towards herd immunity? We had a report earlier in this broadcast about half of Republican men said they don't want to take the vaccine. Are you concerned about the resistance?
Of course I am. I mean, that's something that we really need to do. We have already 3 emergency use authorization approved vaccines that are highly efficacious in the clinical trials. And when you look in the real world results following the EUA, the results are even better. So we're really very fortunate that we have these vaccines. The more people we get vaccinated, the greater protection we have, not only for the individual, but for society in general. And that's the reason why we're putting such a big push in trying to get people to be convinced to get vaccinated. You know, we have this COVID-19 community core, which is getting trusted messengers, be they clergy, sports figures, athletic figures, people that the community trusts and look up to. We're getting information to them to be able to better articulate the need and the importance to get vaccinated. So we're paying a lot of attention in trying to win over those people who, for a variety of reasons, are hesitant to get vaccinated. We've got to do that.
Dr. Fauci, I'm so worried. I remember you saying, listen, America, hold on. You know, it's like spiking the ball on the 5-yard line. We can see the finish line, but we're not at the finish line yet. So I've really taken that to heart. But this is the thing. The COVID cases are going up. Also, the states are reopening. That Texas game the other day, people sitting shoulder to shoulder, some with masks, some without masks. Do you think it's okay for us to now go to places? Because I look at this, I see super spreader. Is it okay for us to go to events wearing a mask?
Well, you know, it depends on the level of virus in the community, Gayle. That's the important point. And that's the thing that I and several of my colleagues in the public health arena, the director of the CDC and others, are saying. Every day that goes by, we get closer and closer to where we want to be. And we don't want people now all of a sudden to declare victory prematurely and then feed into what is a potential surge. What we are seeing, if you look at the numbers every day, we had that peak, we came down, we plateaued, and we got stuck there. Now we're starting to inch up, and several states have increases in cases as opposed to a leveling off and decreasing. We've got to hang in there and not completely pull back on several of the mitigation methods of public health, because if we do that, we're tempting another surge. Yeah. And as I mentioned, you balance that against the vaccine, because every day we hang on and don't allow a surge to occur is an advantage to us, because every day we get 3 to 4 million more people vaccinated. That is critical. If we do that for another few weeks to a month or more, we're going to be ahead of the game, and that surge won't occur. Yeah. It just makes common sense.
Yeah, but Dr. Fauci, there will come a point where we have vaccines available, but there's a hardened population that doesn't want them. In terms of getting the vaccine to those people or getting those people to take it, many businesses are debating right now whether to make a vaccine a requirement of people coming into the office or doing business with that business if it's an event. From a public health perspective, because there's a legal conversation that's separate, from a public health perspective, do you support that kind of policy?
You know, I don't think I could come out and officially say I support it, because that's going to be taken, I think, out of context in some cases. I can tell you one thing, that they're almost certainly going to be what you just predicted, namely that there are going to be organizations, they could be universities, they could be commercial organizations, which are going to do just what you indicated. They're going to say, we're not going to have you come in unless you get vaccinated. You're not going to see that from a federal government mandate. But I mean, I would be very surprised if we did not see that at the local level.
Well, from a public health perspective, do you think it would help at the local level?
You know, what I would say that from a public health standpoint, the more people we would get vaccinated, yes, it would help. The better off we would be.
All right. Dr. Anthony Fauci, thank you very much.
Good to be with you. Thank you for having me.